We're going to move on to Sandeep Jain. He's going to present ListenMD.
Yes, hello. Um, I'm on my Zoom phone call. Yeah, so I'm a physician, a pulmonary and ICU physician, and I ended up making something during the COVID epidemic that I'm finding so useful that I believe more people should use it and benefit from it. So I could show it by sharing the screen of my phone, and let me do that. Can you see my screen?
Yes, we see your apps.
Well,
Screen.
the app I created is called ListenMD. I ended up getting some patents for it, and I'm using it every day in my practice and with my doctors in my hospital and with my patients and with my resident doctors. And what happened is in COVID, we had a new disease which nobody knew how to treat. So we had large numbers of people. Um, and so I made up some ways to treat them fast, you know. So this is just like a reporting system that I built also. So we were having like hundreds of patients with COVID in the hospital, and then some of them were on BiPAP, high flow oxygen, different types of oxygen, and we had no idea how these people would get better or worse. And for an example, I made a system of entering the data very simply, where you could see if all the bars became red, that person died. If everybody started to become green, as you get better, it becomes green, so that person lived, you know. So, and you could see, in fact, the data was so good that based on a few criteria, if there were 10 people who were in the floor, one of them would crash and try to die, you could predict which patient would actually uh, be getting worse next. And you could see what was working. You could, increase the steroid. Let me show you in a different way. I'll pull up my own name, so it's not a HIPAA issue. Hold on. So the app has a card for every patient in my practice. Has a card. I can do lots of things with it. I mean, of course, the usual things you do, where they are, who the other doctors are. It can connect through all the other doctors. You can talk to past doctors, present doctors. That's a big problem in medicine. Nobody knows who's taking care of the patient. And then I have some patent on distraction-free messaging, which allows us to communicate, and it allows me to put their location or things like that, and then call them, and then my phone number doesn't show, my office number shows. I can do video calls with patients. I can call the family members. So in the COVID, I was calling them through this, because the hospital bought hundreds of iPads with the Teams and all that, but nobody could use them. This was much simpler to use. One person could enter the patient information, family information, and you could actually do a video call, and you can instantly talk to the patient and the family member, or with one of them or whatever. So that's all true. But I'm more excited about this business of this snapshot view that I ended up making, which I'm using for every single thing now. So going back to the COVID type of thing, since that was the birth of this. So to handle COVID, you had to have oxygen, right? So how much oxygen they are on. So if the person is now on 2 liters oxygen, that means he's better. So that bar becomes green, right? The oxygen will become green. And you can see how it became green quite quickly. So you get the feel for the information. So doctors make decision using a few parameters. Some of them can be labs, some of them can be physical exams, and they use them to increase the steroid, or to change their steroid dose or whatever. So whatever we do can be followed very closely over months in a sick patient. So anything I'm doing, like deciding to extubate, deciding to do anything, can be entered like this. And then in a list view, you see it and you create a note. So if the note gets created, it shows that this is going on, and this is why I did this, that. So it becomes very easy for a doctor. So as a doctor, I don't want to be involved in looking for information. The Google search can do that, but in medicine, we are always searching labs which are already done, things like that. So the system, if I say to do dialysis, I need this information: how much urine output last 2 hours, how much in 6 hours, how much in 2 days, what your creatinine went up. I can say dialyze. If I have a patient who I'm a lung doctor, so to decide whether to get a person off the ventilator, I need the information about mentation, hemodynamics, secretions. Well, if his secretions are too much and he's not able to get those secretions out, then I will have to, then it becomes red. And then the action I will take is the patient is not ready to extubate today, and the charting is done. So basically, I have created a system which lets the doctor do what they like best, which is to decide. Sucking in information is entered by residents and different people and myself too. And I'm working with the hospital, connecting with Cerner, so that the information be sucked in and halfway filled out automatically. And then the information, whatever I did about that issue, will be charted and pushed in automatically. So this clipboard system allows me to take photographs, videos, and alarms, and send information to other doctors. So it does a lot of things. The app is sort of many things it does. So I keep in touch with my other doctors who basically might want to see a video of I can send the information to them, right, about how a person's CAT scan is doing or something. I guess it's not playing because it's on Zoom. Okay, whatever. So are you still with me? Are you still able to see the picture?
So far, so good. Thank you.
Yeah, all right. So then also there is a patient app that allows me, all my patients loaded. So this allows patients of mine to call my office and do different things with me. It allows the patient, actually most important is they add their own doctors. They can search and add the information of the doctor, and it searches the NPI database and puts up that doctor. And then even if that doctor is not using ListenMD, they can put their own appointments. So it becomes their alarm clock, and they can take notes about every patient. And so their present doctors, past doctors, they can take pictures of their records and then share them with the doctor. This is just demo for my. I can create self-assessments. So like if I did a surgery, I can create systems where the patient will get questions here and there and there in their phone, and then the patient can view that assessment and watch how his pain is increasing or decreasing and what he's going to tell the doctor, things like that. But even better, this information becomes available to the doctor, right? So the doctor can actually, ask for the snapshot, right? He can say, hey, what are the self-assessments you are doing? Oh, you're doing a post-op self-assessment, share it with me. And then the patient will get the message that, hey, the doctor wants to share your self-assessment. And then the doctor can then now see that self-assessment for this patient the same way that. So when the patient comes to my office now, he doesn't have to talk too much. I mean, I can just say, where is that self-assessment? Okay, here. Post-op, yeah. So I can just say, don't talk, let me see. And then I see what is pain and diet and whatever action is going on. And I can create a list view and create a note, and it goes in my chart. So there's a lot of work to do in terms of connecting to Cerners and Epics and different EMRs and automatically transcribing different data. But it gives me alerts and messages. I can do internal messaging. So I have some patent regarding distraction-free messaging, which basically is a way to not disturb the doctor or among doctor to doctor when we talk about it to each other. So in the settings, I'll have to just see. So you can have your distraction settings, medium distraction, so people can choose what time they want me. So I can set message time. So I want to get a message morning, afternoon, evening, and then the message that I see from someone else, I can pull the future messages out. So it's a concept that may take time to explain, but the basic idea is that if there are 22 patients and 5 nurses, and they all want to talk to me at 12, 12:15, 12:30, 1 p.m., 1:30 p.m., they are able to see that I will be checking the message again at 3 o'clock. If it's really you want me today, Otherwise, next I'll be checking the message tomorrow, and the next will be next week at 12 o'clock is my silly time. I'll check even silly stuff. So then we doctors are kinder to each other when we message each other, so we don't disturb each other so much. And then if I do get time, I can pull a given message from the future based on whether it is which patient it is for, or on a different parameter. So I can pull it out of the future. So the patent lies in the fact of delaying the message and then pulling it out of the future at the right time. So that is one patent. The other patent about that, the snapshot, the snapstick, whatever, the snap, I don't know what to call it, the spider graph maybe. I've been calling it
Sandeep, time check.
snapshot. So
Time
basically,
check.
this spider graph that I'm making, this is very beautiful. This has changed my life and is going to be very
Sandeep, can you hear me? Sandeep.
Yeah, I can hear you.
Check.
Sorry, I want to.
Okay.
I put the volume down. Yeah.
Okay.
Sorry. Yeah.
Time check. Wrap it up.
Yes, go ahead. I think I'm done with the presentation part of it. Yes.
Who wants to ask questions first?
I'd love to jump in here and basically say that honestly, I'm very impressed. I love how you created a tool to help you do your own job, and that you have organic traction within your own professional network, right? I mean, that's really cool. You're not an outsider trying to push technology in. You've made a tool that clearly creates what I'm seeing is like a real-time integrated health map of the patient that helps you kind of prioritize your time as well as the patient's severity. So I would love to help you raise money for this. One question would just be, as you've started to look outside at other people doing, trying to do what you're doing, do you see any competitors that scare you, or how would you describe this against the competitive landscape?
Well, I mean, I've had people wanting to invest, but they always want me to give up being a doctor. So I sort of have put my own money so far into it. But really, there's no competition because I have the patent for distraction-free messaging. I've applied for the patent for the visualization system that allows a doctor to make decisions using systems. So things like, Cerner and Epic might be interested. So I've been reaching out to those type of people, and they can buy out as a strategy, or I can build this up with investment and take it forward. I mean, I'm talking to different ACOs who can use it. So, I mean, it can run a small country. I mean, the whole thing is completely integrated. I mean, you can upload lists of patients. Oh, I didn't show you the billing stuff. I can upload the whole hospital list of patients. My patients come, I can slide and send it to my biller. I do my hospital billing with it. The whole, what else I do? I mean, I've put everything in it. It has like 500 APIs or something. But yes, I have made the maximal perfect product instead of the minimal viable product. I know. So now, yes, it's because it's so exciting. I want to have other people use it. Yes.
Cool. Thank you. I sent you a LinkedIn invite, but let's let other people come in.
You probably spoke to this and I may have missed it, but when you were talking a little bit about the COVID stuff, did you, based on the other data that doctors were putting in, did you change your treatments for patients based on that?
Yes, because it was an unknown disease.
Yes.
It was like the Wild West. I got a text from a doctor in Florence, Italy, who texted to somebody in Seattle, and it came to me and says, WHO is wrong, steroid is working, give steroid.
Yeah.
And we give steroid. And then I'm following my thing, and I'm seeing my patients improve with steroid. If the patient's D-dimer goes up, I give them more anticoagulation. So we actively use this system in large volume to try to improve the care, because nobody knew what the hell we were doing. So,
I love that. I mean, I could see that being applied in so many different use cases. And I think, when you're thinking about clinical decision support, I think it could be a really, really good use case. And I would love to see if you guys could partner up with more hospitals and try to continue to grow that data set.
Yeah. Also, the system that I've developed involves curated data. So there's a difference between data that we speak in a conversation with patient and transcribe, or that we write as a doctor in a note that we just want to get billing done for. But this is core data. A doctor has thought through what important information is required for that decision. And the AI that comes out of this data is going to be much more valuable. So
Yeah.
I've already put in for a patent. Actually, I got a patent for the data usage and AI. So I actually got 3 patents. So there's a patent for this type of data usage also, which applies this to create diagnosis using Bayesian mathematics. So that's true. And the information, if it starts coming in from the computer, the hospital systems into it will decrease the doctor's workload. So the idea is that doctors want to spend their time deciding, not looking for data. So if I have to decide to dialyze or extubate or intubate, what information I need, I've already specified. So, and it's very fast moving, because a week or two ago, a study came out, ABC 123, about how they use the movement and how moving patients in ICU makes you extubate better, decreases mortality, whatnot. So the Epic set up this system. So in Epic, the system got built and then they did it. But here I could just look at that study, copy what they did in that study, make a snapshot for myself, and I'm going to apply it tomorrow when my ICU starts. I'll start using it and improving care tomorrow. So, so a doctor can easily build new snapshots that he wants to use. So it actually is very flexible.
That's great.
Thank you.